French scientists say they found evidence of an effective HIV cure among adults if they're treated quickly after infection. The study looked at 14 patients whose bodies have been able to control the virus even after they stopped taking medication. It follows the so-called functional cure of a baby girl in the US. To discuss the potential implications, I'm joined by Sarah Radcliffe from the UK's National AIDS Trust. Thanks very much for coming in. Well, how significant is this finding?
This is really exciting from the perspective of it's another step along the road to a cure for HIV, in this case a functional cure, even though it is some years off in terms of practical applications for people currently living with HIV.
So presumably the key here is to get diagnosed early. Is there still, though, a reluctance for people to take an HIV test?
It's true that people tend not to be diagnosed early. In the UK in 2011, which is the most recent statistics available, only 47% of people were diagnosed late, which means after they should have started treatment. A very small number would be diagnosed this early.
And we've had that research that we mentioned there in Mississippi, the baby girl who was functionally cured. Is there a danger that with the kind of the appearance that we're getting closer to a cure, that there's complacency, that people start thinking, well, it's actually not something I have to worry about so much?
I would hope there's not complacency amongst people who are thinking about HIV on a day-to-day basis, but I suppose in terms of perceptions, it might appear that we're getting very close to a complete eradication, which is not the case. So I suppose the message for people who are already taking treatment is they definitely need to keep taking that treatment. And
worldwide, I understand the figures, according to the UN/AIDS programme, the number of new infections is actually falling quite dramatically. 2011 it was 20% lower than in 2001. What's that down to? Is it down to campaigns, or is it down to kind of a natural progression of the disease?
There's been a variety of interventions over the years, so obviously prevention campaigns are really important, people knowing how to prevent transmission, but also treatment itself, HIV treatment, is really effective at reducing people's likelihood of passing on HIV. So as more people get treatment, they are less likely to pass on the virus.
I suppose the difference will be depending on where they live as well, because those drugs are not available as easily worldwide, are they, as in the developed world?
That's the case. I mean, obviously in the HIV, the drugs are available, so the real barrier there would be people being tested and diagnosed in the first place. But where people are less able to get access to treatment, we would expect the spread to be increasing more.
OK, Sarah Radcliffe, thanks very much indeed for coming to talk to us.